Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts. Hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, and welcome back to another episode of the MedEvidence podcast. I'm your host, Dr. Erich Schramm, sitting in for Michael Koren today. For those who don't know me, I'm a board-certified family physician and long-term clinical research investigator, and have been with the Encore Research Group more than 20 years. And I'm really excited today to be talking to Dr. Christy Kestner. Now, Dr. Kestner is an esteemed neuroscientist, science writer, and science content creator. Welcome to MedEvidence, Dr. Christy Kestner.
Thank you for having me here. It's an honor to be here today.
Well, thank you. And it's okay if I call you Christy?
That is perfectly fine.
So, a little bit about your background. I read your bio, and quite interesting. You have a PhD in neuroimmunology. You had 10 years experience as a benchtop researcher, and then more recently involved in creating science content and science writing. So maybe you could tell us a little bit about your background, maybe tell you where you grew up and how you got interested into neuroscience.
Yeah, so basically my path has definitely not been a straight line and not linear, which has made it all the more exciting. Actually, I grew up playing tennis my whole life, and like briefly at one point I considered pursuing a career in tennis. But since I was a kid, I just knew I always loved science more. And so in college, I was your traditional biology pre-med major. But during this time, my grandmom had Parkinson's disease. So I felt like I was always just curious of, what's causing this? Why is she stricken with this disease? So I feel like that's really what kind of like piqued my interest in a neuroscience. So after I graduated college at University of South Carolina, I moved back to Atlanta and pursued a master's degree in cell biology. And what was cool here is I feel like that's where I really got a lot of exposure to neuroscience courses. And I feel like there is where I just fell in love with neuroscience. And I just lived and breathed it. I just thought this was just such an interesting field. So after my master's degree, I ended up moving to Charleston and pursuing my PhD in neuroimmunology. So here I basically focused on, it's called the complement system, which is part of the immune system. So my overall goal was looking of how this plays a role in brain injury or stroke in patients. And so what was cool is we did a lot of complement directed therapy development during my PhD. So it really made me aware and realize how you can really modulate the immune system for better patient outcomes. So that's how I got into neuroimmunology. And then after that, I took on a brief postdoc role also at MUSC, just focusing on pancreatic cancer drug targets. So after all that, I really thought, I'm going to be a scientist in biotech. Like, this is my dream, to transition from academia, being a benchtop scientist for years, into the fast-paced world of tech. And, with the way the market is, it's just tough to get jobs. And also, my husband is established here in Charleston, so I couldn't just take off and move somewhere that was offered a position. So it was definitely challenging. So during that process, I felt like I started learning more about scientific writing and medical writing roles. And I thought a perk of that was, it's remote. I can work from home. I can travel for conferences if needed. So I got into that and took a freelance scientific writing role with a German biotech and consultant company that I still work for. And then from there, I just was like, you know what? I'm going to expand and build my scientific portfolio. And that's kind of how I transitioned into creating Brain and Beyond. And so it's definitely been like an interesting path, but it's been like really, really fun and enjoyable too.
Wow, that's great. Always great to hear a non-traditional route. Had you always had, a skill and interest in writing, or is that something that just you kind of cultivated?
Yeah, I think honestly, when I realized this is something I was passionate about and really enjoyed was during my PhD. I feel like one of my favorite things during that time was just researching new neurotopics, learning about them, diving into the literature on PubMed, and then writing about it and just conveying it to, not only scientists and other students, but I feel like I had a chance to just, disseminate this to the general public too. And I think that's where I figured out that, like doing the science is a lot of fun, but for me and my personality, I thought this was a bigger fit.
Wow, that's really impressive. Back to the time that you were dealing and you were doing your PhD and you're working with patients with traumatic brain injury, were these athletes or were these people in like accidents? What kind of patients were you dealing with at that point?
So actually, I focused on animal research. So all of like the treatments I was focusing on were in mouse models. And so I definitely got desensitized to this because at first, you get a little emotional about it. Like I have pets and, you want to get attached to them, but you have to think, okay, like I'm helping the greater good. But I feel like where I was fortunate enough not just to have the typical basic science training is I got grant funding in my second and third year at T32. And part of that requirement is we had to shadow a physician that was related to your work that you were doing. And so, what was cool in our department, we were very collaborated with the neurosurgery department. So, for one whole summer, I did get to collaborate with a pediatric neurosurgeon. And I mean, it was amazing. I got to scrub in on a lot of rare cases. And so it was like, it's really cool just seeing what you're doing at the bench and how, that can translate to the bedside.
Wow, those sounds like a life transforming experience. But it's interesting in your career. At some point, you made a decision to pursue the PhD rather than the MD. What was involved in that decision making?
I always loved science. I loved medicine. I think I kind of dabbled just as a kid if, I would be a physician or a scientist. And I think just the older I got, especially more like in college and during my master's, I felt like the questions I was gravitating more to is why is this happening? Why is this working? What is it that's causing this disease rather than treating the patient? I think that was like one aspect. And I think also just kind of growing up, being an athlete, I'm an only child, so I'm very independent and comfortable with that. And I feel like I'm an extroverted introvert, if that makes sense. So people can exhaust me after a while. So I thought it's probably best to stick to the scientist route instead of, pursuing becoming a physician and interacting with, dozens of patients every day.
Yeah, and I'm sure all that important work that you've done has helped thousands of
Yeah.
patients, and again, you're also dedicated and committed to making science accessible, right? Not just to the general population, but to physicians and clinicians. Kind of tell me a little bit about that and how you do that.
Yeah, I feel like, just coming from academia, right? It's such a different experience than, being in private practice or, just being a physician, like working outside the hospital setting or even working in tech. It's very, I don't want to say siloed, but I feel like you're just kind of like stuck in this niche and you're kind of protected from the outside world. And there's people love it. That's great. It wasn't for me. There's nothing wrong with it. Like, I think that we've done a lot of good research that has come through academic science. But one thing I really noticed, especially through my experience being a PhD student, is I think there still is this kind of like antiquated way of thinking of becoming a scientist. And like some things I wish I'd learned during my path was alternate career paths instead of just being a benchtop scientist. I wish there was more like mentoring workshops or like, I don't know, Zoom sessions to discuss about this. And then also, I feel like just with the science I was doing during my PhD, a lot of the work is just so cool and exciting. But, most people are never going to hear about this, right? Unless, you're a physician or scientist and you're reading academic journals. So that was kind of my mission. I was like, you know what? Science shouldn't stay behind academic institutions. We should bring this to the public, especially, research or current technology that's being used right now. And let's, disseminate this to the public just in a storytelling manner. And I feel like that's what I've really tried to bring home is to just tell the science in a storytelling way, just to engage your audience where not only are they learning from this, but you're building credibility with them because you're an expert in the field. Then also like they're building trust, and I feel like they're feeling empowered by learning more about the science and what's going on.
Right. And honestly, I was smiling as you were talking about how there's a lot of expectations and being in silos, and we tend to in medical training be very compartmentalized, and you follow a lot of people whose traditional path, at least as being a physician, is like, okay, well, you're down this path, and we're not really groomed to be entrepreneurs, or we're kind of worker bees, and so hearing your story about looking to being able to make this pivot and seeing and opening up, and I've seen you make comments say, look, we've got you don't have to have this traditional path, that you can appeal to a wide group of people, and can see that this is really what we should be nurturing, whether it's in our med schools or in our PhD programs, and because we all become once we expand our skill sets, I mean, we're I think a lot of what, and we were talking earlier about one of the things that we want to be able to create in a space is, working and trying to combat a lot of misinformation and disinformation out there. Maybe you could say a little bit about that and what your experience is with that.
Yeah, I feel like that's honestly another huge driver of me creating this platform is just the way the world is right now. Everybody's basically getting their information from social media. And although this is good, I feel like there's a lot of information that is not accurate. And to combat that, I mean, we just need more professionals like physicians, trained scientists, just to step up on this platform. That way, you're not only bringing your credibility to the platform, but you're also bringing a unique skill set of just having an evidence-based perspective. And just by having that, you're able to like sift through a lot of, the noise. And so by having a lot of physicians and scientists just kind of like stepping up to the plate, I feel like, again, this way of being able to communicate either whatever clinical specialty that you're specializing in, whatever science interests you, if you can just disseminate this to the public in an engaging way. I feel like the key here is trust, because there's just so much mistrust with what's going on in science. And I feel like kind of how I've been tackling this is, I always add references and sources to all of my posts. So that way, like my audience knows, okay, this is credible. I have basically kind of, I want to say like a little mini library on like my link in my bio where people can click through and find the post where I was talking about this source. And if they're interested, they can read more in depth about like what I was discussing in a bite-sized manner. So I feel like by just pushing, references, you're establishing your credibility. That is huge. But then on the other hand, I feel like it's tricky too, because sometimes you might have to talk about topics that are uncomfortable, like talking about psilocybin with cancer patients. And I feel like a lot of these topics can get kind of clickbaity in a way. And so, I feel like people are naturally curious, but without having like the bigger picture, I feel like that's where misinformation can kind of creep in. So I feel like it's our job to kind of like step in, talk about this, show them the evidence, but also show them the limitations. And that way people can engage like in a responsible manner.
Right. And we were talking a little bit about earlier about some of the challenges to do Scheduled One research. So, whatever people don't know what Schedule One means, these are typically types of drugs that the government has assigned to certain categories. And here we go, for controlled medications and, psilocybin, cannabis. We were talking about cannabis. But these are very difficult to study compounds, even though, they've been around for centuries, and more recently in medicine we've used them. So we know the potential therapeutic value, but it can be frustrating because we're scientists. We'd like to, we really like to design a study, and here's how we'd like to do that to prove that point. But on the other hand, when we know that something that may be helpful for patients, we want to put our patient's interest first. So I want to be true to my research self, but at the same time, I want to do the best for the patient. So, and I can hear that's the kind of approach I think you have. I hear that in you. So I applaud you for that. And I hopefully one day we'll be talking about doing Schedule One research on. We'll come back and do a psilocybin or a cannabis talk, something like that would be fun because everybody asks about it. So I'd love to take a time to do it.
I mean, with these, I feel like with the public, it's just kind of breaking that stigma too, right? A lot of people just think of, cannabis research in one manner. And I'm like, it's not bad, especially if you're monitoring this appropriately.
Right. And I am a cannabis certifying physician in the state of Florida, so I am nodding my head in total agreement, and I'm ready to be taking that the next step forward. Yeah. So maybe sooner rather than later, but we'll see. Who knows? So you've made a great point about we're kind of attacking disinformation, putting everything out there, and doing it with integrity. And honestly, I can say that I've spent the last few hours reviewing and looking at your Instagram reels, and in the interest of research, right? Not just scrolling on Instagram. Sometimes that happens, but it's Instagram. That's what it's for. But I'm so impressed with the quality and the content. And getting back to being able. I know part of what you do is to create this visual impact for learning. And I was like, wow, I wish this was around when I was in med school, because, then it all kind of makes sense. You're like, okay, you're not just out there saying, okay, here's, complement, C2 or C14, whatever, you're like, okay, so you can really make this connection. But these, for these reels are short, but they're very dense with science, and I'm like, wow, that's the real deal. So hats off for you to be able to create such succinct and effective content.
Yeah, I feel like that's a challenge like a lot of scientists have and struggle with, and I feel like I've practiced this heavily, even like with my dissertation. Kind of, I was always taught, okay, you should be able to break things down so your grandmom can understand it, right? So I felt like, I would practice with like my husband, my family. And it's been fun. And like a lot of my friends, I have a lot of friends that are in healthcare, but some aren't, and they're curious and want to know. So, just even practicing having conversations with them, and, they give good feedback of like, hey, you could have explained this a little better. You could have broken this down, or no, this makes sense. I get this now. But it's been crazy because, like you said, you're just used to learning in a classroom setting. And so I've kind of had to get like more creative, more with like the marketing side, I guess you would say, of how to just like hook people in so then they stay for the message. So it's really cool just to see what all is out there. And, I haven't even like utilized all these different platforms, but it's untapped potential. And that's why I kind of got into it, because I saw, there's a lot of physicians and scientists talking about the misinformation, what's going on with like the current state of our government, but it was like, there's not much that's educational out there for people. So it's been fun.
Well, no, I'm good. Great, important work you're doing. Tell me a little bit about you founded Brain and Beyond. What's that all about?
Yeah, so basically, this sounds so cliche, but like in the middle of the night, I was asleep and just had some ideas of, how can I like start conveying this just to general audiences? So, brain, because neuroscience is my favorite subject. And so I thought, you know what? Let me expand this into three areas: neuroscience, immunology, and oncology, just kind of based off of my experience. And that way I had a lot more content to work with. And so I thought, I'm just going to like kind of make a theme and rotate through this weekly. And then from there, I thought, okay, I need to like kind of mix it up day to day if I'm posting weekly, just to hook people to get them to stay. So that's where I started thinking of, different themes like Mythbusters. People love that. It's clickbait, but I'm like, to make it in an educational way. Like Fun Fact Friday, same thing. It's a little clickbaity, but I'm like, no, I'm going to use this to hit them with the science. So I sprinkled that in, with some like tech for Tuesdays, just to make people kind of like what's going on in the world with advancements in each one of those fields. And I thought throwback science, hey, this would be a cool way to talk about history in the field. So that's kind of how that came to be. I mean, when I created it, I thought, okay, my friends are going to be kind and supportive, and that's probably going to be the only people that are going to follow this. And I'll just use this to expand my portfolio. But it's really taken off. And I feel like what really kind of got me to the next level, Harvard has a free educational platform called Lab Exchange that you can access online. And so they have an Instagram account, and I reached out to them because I saw that they do like to collaborate with a lot of scientists. And I just said, hey, would this be something you would be interested in collaborating with? And so they, looked through a lot of my content, loved it. And then the rest is history. I've had, more and more collaborations with different people. So it's been like a really cool and fulfilling journey. And I feel like really the most fulfilling part of it is, I'll get like a lot of people in my DMs that are like, hey, I would love to like learn about, from your experience, what you did through your PhD. I'm thinking of doing, this, or, oh, I had a family member who had a stroke. These topics, this is making this like helping me understand this process better. So I think that's like the humanizing aspect of this, is that at the end of the day, I am helping people, which is really, really cool.
Very impactful work, and congratulations on. It sounds like it just keeps scaling to new heights, and all that accessibility and reaching all the physicians and clinicians. It sounds like you're spot on with that. So congratulations on that.
Thank you.
You also have you're writing Endosymbiont. Is that correct? You've been part of that platform.
Yep. So that's the German biotech company that I was previously mentioned. So they focused all of their writing onto a website called Medium. And so all their publications go there. And so what I do for them is basically there's probably like 4 or 5 of us writers. And so we just kind of like split the work evenly. But they assign us a different cell type in the body. And some of it, I have no knowledge about outside of like my neuroscience wheelhouse. And so here again, that's where it's like so useful having a PhD, right? Because you're having to dive down in the literature, learn about this, where you're kind of creating a literature review. And what's cool there, and I feel like my language there has translated nicely to my Brain and Beyond, is their focus too is to make this educational and very engaging for their audiences.
Well, what I've seen in your content, I think that's very approachable, very accessible. I can imagine just what a great resource that is and would be for people.
Yeah. I feel like the biggest takeaway, right, is a lot of people just kind of have this preconceived notion that science is intimidating, and it doesn't need to be. It can be fun to learn this.
That's right. I'm having a great time. Honestly,
Yeah.
I'm going to be looking at those Instagram reels soon. I like the one with the pets. How our pets make us
Yep.
feel better,
Yep.
and I'm like,
Yep.
oh yeah, it's all about the oxytocin, right? All those
Yeah.
feel love and feel good brain chemicals. So,
Exactly.
um, one last thing. Tell me a little bit. What do you see coming down the pike? What gets you excited about the future of neuroscience right now?
Well, like the future, I think with like just the way like tech is headed is just so cool. Just kind of seeing where we were, like in the early 1900s, like with lobotomies, which were so barbaric. And so now moving forward to 2025, I mean, brain computer interfaces are like the big hit right now. And I was actually reading, there was a publication in Nature about a month ago. I can't remember what the clinical trial was. I think I wrote it down. The brain bait 2 trial. Anyways, but it was a patient who had ALS. And so they implanted this device in his brain. And just by using different algorithms, basically these signals were interacting with his neural activity and actually allowed him to produce natural sounding speech. So, I mean, we're living in the future. I think just with how neuroscience is evolving right now, it's really, really fascinating.
Wow.
Hmm.
One last question. The other day, I was doing a talk, and we talked about biomarkers, and we were talking about Alzheimer's. And there's more recently some biomarkers that have come out
Yeah.
as p-tau 217 and some other things that
Mhm.
are look really good for identifying maybe Alzheimer's patients at an earlier stage of the disease. And one person asked me and said, okay, well, look, do you think that there could be like a vaccine out there on the horizon that might be a possibility for people with Alzheimer's? And we're, as a research organization, we have done all kind of vaccine studies, not just
Yeah.
infectious disease. We've done acne, we've done all kind of things. And at first I was like, wow, that seems kind of like a long shot. But then thinking it through a little bit, so said, well, maybe I wouldn't rule anything out. So I didn't know if you had
Yeah.
a thought on that.
No, I mean, that's a really interesting point. I think we are closer to that than we were, 20, 30 years ago. I think we still have a long ways to go. And then I think that's another reason why neuroscience is so fun to work in the field because it's tricky. There's a lot we still don't know. Like in the case of Alzheimer's, Parkinson's, brain injury, and it's just there's so many players to the puzzle. And I think that's what makes it so tricky to treat. You think, okay, it's just this one part of the immune system that's causing it. Well, no, wait, let's step back. Okay, well, then the aging process is a part of this. So it's very multifaceted. And I think we're getting there, but we still have a ways to go.
No, I'm hoping they're going to have it all figured out by the time I get to that age where I may have already gotten there.
Yeah,
I'm not sure, but
I know.
I'm hoping they're going to figure it out sooner than later. Last thing, any question that you wished I had asked you, or would you like to add to?
Well, I was just gonna say, just thank you for having me and like kind of what you were saying too of like my journey. I feel like what's been cool is this has really led me to more of like an entrepreneurship role, which are things that scientists and physicians don't really know unless you are kind of like thrown into it. And one thing I did want to bring up that I'm like really proud and excited of is I am launching my first mentorship cohort this October, which will be focused more on PhD students, like early science communicators in their career, science writers, just to give them like more feedback and personalized, like, one-on-one, in-person exercises, just stuff you don't get in academia, right? And so, I feel like my journey's been really insightful. And then a lot of the lessons and failures I've made along the way, that's how you grow. And so if I can impart this knowledge on someone else, then I feel like, I'm doing my job. So we'll see. I mean, still growing. It's fun. It's a journey. I mean, I love that I've gotten to know Chase through MedEvidence. I love what you guys are doing here. I mean, it's really impressive.
Well, you're welcome back anytime, and I'd love to pick your brain more on psilocybin and
Yes.
cannabis and anything else you want to talk about. We'll be here for you. So, but thank you so much for your time today, and
Thank you.
best of luck. I know you're going to knock it out of the park with your program. So, thank you again so much.
Yeah. So nice meeting and talking with you today. Thank you.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.